So good afternoon. I'm sitting here today with Dr. Michael Kelly, who is Chief Medical Officer for our behavioral health here at St. Mary's. And we're just talking about how to deal with stress associated with the COVID-19 and all the things going on in people's lives that are changing things so much. So Dr. Kelly, tell us a little bit about, first of all, what is it that you do, and tell us a little bit about how what are you seeing as it relates to stress associated with what we're all going through?
Yeah, I'm a psychiatrist that works over at St. Mary's Hospital. Been here in St. Mary's in Lewiston for 21 years now. And this is different than anything I've ever seen in my entire career. It's one of the first times that a stressful event is hitting every single member of the community. I mean, obviously, everybody's stress is different. Everybody's got a different stress. The hospital workers are under immense stress, knowing that they're putting their lives on the line every day, dealing with this illness. People who are stuck at home have the stress of cabin fever, being stuck listening to these doom and gloom, scary newscasts all day long. People are stressed because they're homeschooling their kids for the first time in their lives. I mean, the stresses are hitting every single one of us. There's all of us being frightened about what's going to happen to our own paychecks and our own incomes and our own jobs as this hits the economy. So it's hitting every aspect of our lives. And it's causing, everybody deals with stress in different ways. Some people, it creates a great deal of anxiety. Some people, it's causing them to get isolated. Some people are dipping into depression because of the stress. And then every single one of us is dealing with it in different ways. I've seen some amazing ways of dealing with stress and some really cool things that have been happening. I think one of the great things I'm seeing over and over again is people who are taking the situation and helping others as one of their coping skills. I've got all kinds of people that are making masks for people and donating them to hospitals or just donating them to their neighbors. I have people that are reaching out to their neighbors, especially their elderly neighbors, to make sure that they're being taken care of. Using that kind of altruism as a way to deal with your own anxieties, your own stress is phenomenal.
People making food. We've had all kinds of people donating, individually packaged lunches to the staff here. So if somebody's interested in food, that's a way to do it. So it all depends on the individual.
I have a lot of friends who've told me that they've got time at home. It's really invigorated their love of cooking. They're baking and cooking and learning new recipes because they now have the time to do some of those things, which is just a great thing to take up that time. If you're stuck at home, one of the worst things you can do is just sit there, twiddle your thumbs, and watch TV, especially the news channels. We're really telling everybody, limit the news channels. Watch your news a couple times a day, but don't stay on it all day long, because when you're inundated all day long by that scary feeling and those scary newscasts, it just weighs on you. You need to get your brain off of it by doing something fun and entertaining. We're in an amazing time of the year in Maine that it's great to get outside and work on a garden. Go for walks in areas that you can be socially distanced from people. There's some great ponds and parks that still have walkable areas to just get outside. That sunlight is so good for the soul right now. We're all vitamin D deficient from a long winter, and that sunlight is going to lift our spirits. And the nice thing about it is when you're out there, you're not watching the news. There's all those kind of things. It's tough. We can't play team sports the way we used to. We can't really gather for picnics the way we used to, but there's still a lot of outdoor stuff you can do to enjoy yourself and even to walk with people. My wife and I, oddly enough, we socially distance because I work in a hospital, so we don't stay close to each other, but we can walk 6 feet apart outside and really enjoy our time together and go out to the parks a lot. There's all kinds of things people are doing creatively with electronics now also. People are really using Zoom and Skype and all of these modalities to connect with people. I've got a lot of friends that are just looking up old friends. calling high school friends they haven't talked to for years, calling family members that are across the country, or even family members that are down the street that they don't feel comfortable talking with, and spending time with them. I mean, I've seen people get creative and they're playing board games online together through Zoom. I mean, so there's so many cool things you can do to connect with people, and this may be a time to connect with people more than we ever have, interestingly enough.
Indeed. Now, every day you're dealing with people who have issues associated with behavioral health. Are you seeing any uptick in that type of thing?
Yeah, I mean, unfortunately, this is weighing on people. People with anxiety at a baseline, it's just being amplified. We've taken away people's coping skills. There's a lot of people that go to the gym to cope. There's a lot of people that go hang out with friends to cope. There's a lot of people that hang out at at a bar or at a musical venue, or that's what they do for fun and enjoyment. And we, in this modern time, can't do a lot of those things. So people have lost their coping skills that they normally use, and they're right in the middle of figuring out how to redo those things. I mean, if you're somebody who typically played a musical instrument in a band, you really have troubles doing that. So you may have to do it at home. You may have to figure out how to do that online and connect with other people. And it's taking people time to figure that out, but it's weighing on people. Got a lot of people who have a lot of anxieties and fears already that this is just playing into them. People who have fears of infection, fears of dying, that it really is causing a lot of stress to, and we need to pay a lot of attention to each other and help each other as we cope with those things.
And make sure they're doing all the things that everybody's telling us to do, to wash our hands frequently for 20 seconds and cover your mouth and nose when you sneeze or cough, and all those types of things. And I'm sure that you're doing that 3 times more than everybody else is, but it's important for all of us to do it regularly now.
It is. We're still seeing some people. If you walk around in a store, you're still seeing people who aren't wearing masks and really who aren't taking care of their hygiene. And what we've got to remember is when you wear a mask, you're not just protecting yourself, you're protecting everybody around you. So those things are really important to remember.
Yeah, it's interesting. You never used to see people wearing masks around, and now it's very unusual to go to the store and not see someone wearing a mask. So how things have changed so quickly in our lives.
Yeah, I've got a lot of people that are getting really creative with the masks. My own mother, who's a seamstress, is just making them by the dozen. She's finding all kinds of cool patterns and making fun masks for people. It's a new industry.
Yeah, indeed. So, speaking of the grocery store, explain to me this phenomenon behind the fact that I can't find toilet paper anywhere.
There is this panic mentality that people get when there's any kind of crisis, and for some reason, toilet paper is the one thing that everybody comes to mind that I can't live without. So they start buying extras, and then everybody else sees them buying extras and gets the same idea, and then they start thinking maybe I won't have toilet paper, and so the hoarding begins. It's unusual in the beginning. The toilet paper racks were empty, and yet the Tylenol and the ibuprofen, which you're definitely going to need if you get sick, were still full. Now those have caught up too, but it's been a bizarre phenomenon.
Bizarre indeed. We are living in bizarre times. So how, what do you think, coming out of this, what do you think is going to change in relationship to kind of your everyday reality, both as an individual and here at the hospital?
I'm a firm believer that out of every horrible situation in this world, you can always find something good that came out of it. And I think there's a couple of good things. I think people are going to be much more aware of things like washing their hands and good hygiene as a way of protecting themselves. COVID isn't the only thing that's transmitted that way. I mean, anytime there's a flu bug, or anytime there's a norovirus or anything, that's how those things are spread. And as we all get better at that, we're all going to protect each other more. One of the neat things that our field has changed is that we've had to learn how to do things with telemedicine. Now, for years, we've been encouraging people to use telemedicine because there's a lot of people that telemedicine is a lot better for them than coming in and seeing a doctor live. If you're not very mobile, if it's difficult for you to get a ride, if you don't have a car, hopefully in the near future, you're going to be able to just turn on a Skype video, Zoom, whatever, and actually see your doctor. We can do that right now. I'm hoping that's going to continue even after this pandemic. Absolutely, there's times you have to have a doctor, see them face to face, but I would love it if this becomes the new norm, that people can see a doctor from the convenience of their own home and as quickly as they want to, instead of having to drive sometimes 30, 40 miles to get to their doctor's appointments.
Yeah, particularly in your field where there's not too many organizations that have a behavioral health unit. People drive for long distances to come here, and if you can do some of that via technology, that's a good thing.
And we've got elderly patients that don't drive anymore, that getting to a doctor's appointment can be an amazing chore. It can be an all-day event, where if we could just turn on a computer and have them see their doctor that way, they could save themselves a lot of trouble.
Yeah. That's a stress reducer all by itself.
Yeah.
So let's move on to talking a little bit about how people see stress happening in others' lives and what they can do to help them with that.
I think we all have to keep an eye out on each other. I mean, stress is happening to all of us, but some people it's going to hit much worse than other people. So I think we all have to watch out for signs of stress and anxiety in each other. I think increased irritability, decreased sleep, decreased appetite, any change in how somebody's acting can be a big sign of stress and depression. I mean, the first thing we do to help each other is just talk about it. I think we are so afraid to ask somebody, are you feeling depressed? Are you feeling stressed? I think there's this myth that somehow that's going to make them feel ashamed, or that's going to make them feel guilty for having those emotions. But what we find is the exact opposite. Once you actually ask the question, it gives somebody permission to talk and permission to share, and it gives them the message that somebody cares, which is one of the most loving messages you could ever give somebody. So talking to people, asking just the simple question, how are you doing? Are you doing okay with all this? Can make all the difference in the world. If the answer is yes, I mean, you can start with something simple as in just checking in with them a little bit more, talking to them a little bit more, doing something kind for them. We talked about, just bringing somebody some baked goods or sending them a gift is a wonderful thing. If it's getting worse than that, then helping them connect with help. The help's out there now. Like I said, we've gotten everything open on telemedicine. All of our counseling, all of our doctors, everything can be accessed over a phone or a computer nowadays. So in some ways, help is easier to get than it ever has been before.
Indeed, and technology, that's one of the beautiful things is it has emerged over the last few years, and as opposed to the way things used to be, where we can use this technology to our advantage in a case like this. So, how about leadership? How do people in leadership roles see others or help others in dealing with their stress? And I'm talking about in leadership roles in the community. How do we get a lot of more stressors coming up with the economy coming, and how do people in leadership roles help those that are dealing with stressors in those types, the same kind of ways? Or
I think the most important thing leadership has to do is get the communication out there. There's nothing more stressful than uncertainty. We as leaders need to be open and honest without empty platitudes. We need to be able to tell people what's going on, make sure that they know what's going on. Fear will create panic and anxiety more than anything else. I think people would rather hear a truth that is full of facts than some empty platitude. So we've got to start with just being honest, letting people know what's going on, keeping everybody in the loop, and that's difficult when you're dealing with an organization with a lot of people in it. The second half is reminding everybody that people care. I think one of the things that will upset a staff member more than anything else is if they feel the leaders are distant and don't care and are making decisions just up in an ivory tower somewhere. Which leads to the third one is just we've got to be present. And that's sort of odd in these socially distancing times.
Yeah.
But we have to be there. We have to be touching base with people, checking in with people. They have to see our faces and know that we're part of the team and not just some person in an office somewhere making decisions for people. Checking in, touching base, communicating, and just being there with people. The more we can actively put hands on during times of crisis, the more they're going to see that the leaders are part of the team and want to help as well.
Great. Excellent. Well, thank you for being with us here today. And don't forget to check back at the St. Mary's website. We're going to be doing some Facebook Live, and we'll have Dr. Kelly back answering some questions via Facebook Live soon. Thank you very much.
All right. Thank you.